Araw po muli sa ating mga classmates, sa ating mga tagapakinig. Magandang araw po, Doc. Ipagpapatuloy po natin ang ating topic, Jing Essence number 4. Growth, Reproduction, Development. Essence is organic substance that form basis for growth, reproduction, and development in aging. In children, essence control growth of bones, teeth, hair, normal brain development, and sexual maturation. After puberty, essence control reproductive function and fertility. It forms basis for successful conception and pregnancy. Natural decline of essence during our lifetime leads to natural decline of sexual energy and fertility. Aging itself is a process of decline of the essence. So yung pag nagde-decline na po yung essence natin, yun nga daw, sabi nila nawawala na ng gana sa sex, tapos nakikita yung pagtanda. So pag sa lalaki po, essence flows and 8-year cycles. And women, essence in 7-year cycle. So Tiangu, hindi ko pa alam kung tama yung pronunciation ko, no? Refers to sperm in men and ova in women. Kidney energy of a girl become abundant at age 7. So pag age 7, energetic pa. Her baby teeth replaced by permanent ones, hair grows. At pag 40 na po, tama ba daw ang pronunciation ko? Tiangu? Arrives ovulation and menstruation. Directing vessels begin to flow. Penetrating vessel is flourishing. Periods come regularly. She can conceive. So, simula na pong pwede nang mabuntis. Kasi yung pag nag-regla na yung babae, age of 14. Age 21, kidney essence peaks. Wisdom teeth come out. Growth is at its utmost. At age 28, tendons and bones become strong. Hair grows longest. Body strong and flourishing. At age 35, bright young channels begin to weaken. Complexion start to wither, hair begins to fall. At pag 42 na po tayo, yung 3 young channels natin ay nag-weak na rin. Kaya nagkakaroon ng face darkens. Tapos yung mga buhok po natin, nagiging gray na. Yung nagkakauba na. Tapos sa pag 42 na po, yung directing vessel natin is empty. Penetrating vessels depleted. Tiangu dries up. Tapos earth passage, yung uterus natin is not open. So weakness and infertility set in. Siya na po yan yung panahon na nagme-menopause. Inaman, pag 8 taon naman po, ang kidney energy is abundant. So, yung hair and teeth, yan yung mga paglago. At age 16, ang kidney po energy is even more abundant. Tiangu arrives. Essence luxuriant and flowing. So, yin and yang harmonize. He can father a child. So, age 16 po yun. Kaya very energetic sila eh. Pag 24 na po, ang kidney energy ay peaks. Yung tendon tsaka bone ay talagang malakas na. Yung wisdom teeth po natin nag-appear. Yung tumutubo. Growth is at its peak. Kaya sabi pag ang lalaki hanggang 24 yung pagtangkad nila. At kung age 32 na po, ang tendon and bones at the right strongest. Muscles are full and strong. At kung age 40 na po, ang kidney ay nagsisimula ng humina. Tapos yung hair begins to fall out. Sa mga lalaki po ito, Tapos teeth become loose. At age 48, yung young eye is exhausted. So nagkakaroon na ng face become darker. Tapos yung mga hair ay turn to gray. Pag age 56 na, ang liver energy ay patuloy na humihina. Tapos yun, yung tendon cannot move. Tiangu dried up. Kidney becomes weak. Body begins to grow old. At age 64, hair and teeth can. So,
my
yun po
God.
yung body. Essence as basis of kidney chi. Essence is fluid-like, natural affinity with yin, considered as aspect of kidney yin. So provides material basis for kidney yin to produce kidney chi by heating action of kidney yang. Kidneys compared to a large cauldron full of water. Fire under cauldron is provided by kidney yang and gate of life, Ming Men. Water inside cauldron correspond to kidney essence, resulting steam, example chi, corresponds to kidney chi. Kidney essence necessary for transformation of kidney yin into kidney chi through warming action of kidney yang. Tingnan po natin yung drawing next slide. So, ganun pa, no? Relationship between kidney yin, kidney essence, kidney yang, kidney chi. So, parang ganun. Nasa ilalim po yung kidney yang, fire. Siyempre, siya po yung nagbibigay ng init. Tapos yung kidney yin, yun po yung ando yung kidney essence. Tapos yung steam niya, yun ang kidney chi. Yun yung umaakyat sa ating katawan. Ganun po yung process. So, ganun pala yung doc. Thank you po.
Thank you very much. That was very informative, Ma'am Mildred. So at least alam na natin kung saan tayo lumulugar.
Kaya po, yung bawat stage ng buhay natin, naalagaan natin yung organ para hindi po nadideplete agad yung energy, ano?
Yes, kaya there are people, they look older than their age.
Opo.
Dahil hindi masyadong maingat, no? Okay.
Opo.
Kaya
Mas
for those who
maagang.
want to look young, feel young, kailangan ma-educate na natin yung mga tao na to have regular acupuncture treatments. Kahit
Opo,
wala
para
kang nararamdaman.
yung sa kidney ay mas ma-replenish. Yung kidney
Ma-restore.
essence.
Okay. Thank you very much, Ma'am Mildred. We will now go to tongue diagnosis. Let's welcome Ma'am Teresita Sumile.
Good afternoon, everyone. Welcome po sa tongue diagnosis, and still we are on the continuation of our topic yesterday, tongue body shape. Number 4 na tayo, stiff tongue body shape. A stiff tongue A stiff tongue lacks normal suppleness and flexibility. It looks hard and stiff. It indicates internal yin, blood stasis, or severe yin deficiency. So ito po ang itsura ng stiff tongue body. And since this is also very purple, so it indicates blood stasis. Okay? Next is flaccid. A flaccid tongue is flabby and in severe cases has a crumpled look. It always indicates lack of body fluids or blood. Then we have long tongue body shape. A long tongue is rather narrow and when extended protrudes further than normal. Not commonly seen, it always indicates heat. Next is short tongue body shape. A short tongue appears to be contracted and the patient is unable to extend it from the mouth cavity. The significance of the short tongue depends on the body color because it can indicate two opposite conditions. If it is pale, it indicates severe internal cold and yang deficiency. If it is red and without a coating, it indicates severe yin deficiency. In the first instance, the patient cannot extend the tongue enough because internal cold contracts the muscles. Whereas in the latter instance, he or she cannot do so because there are not enough fluids in the tongue. So, if the tongue is short and pale, it indicates severe internal cold and yang deficiency. The patient cannot extend the tongue enough because internal cold contracts the muscles. Okay? Now, if the tongue is short, red, and without coating, it indicates severe yin deficiency. the patient cannot extend the tongue enough because there are not enough fluids in the tongue. So this is the difference, okay? Now let's go to cracked tongue body shape. Generally, cracks in the surface of the tongue indicates yin deficiency or the tendency to eat. However, although this is the most common cause, there are others such as dampness or deficiency of the original qi. Horizontal cracks indicate yin deficiency, usually of the stomach and or kidneys, and they are more commonly seen in the elderly. Irregular cracks usually indicates stomach yin deficiency or the tendency to eat. Okay. Now this is an illustration of a tongue with horizontal cracks indicating yin deficiency, usually of the stomach and or kidneys, which are commonly seen in the elderly. Okay? Ito naman ang itsura ng irregular cracks, usually indicating stomach yin deficiency or the tendency to eat. Ito po ang real picture of a tongue with irregular cracks, again, indicating stomach yin deficiency. Okay? A central crack, short crack in the midline of the tongue is very common and indicates stomach yin deficiency or the tendency to eat. A central long crack in the midline of the tongue is also common. Its clinical significance depends on the depth and on the color of the tongue body, especially the tip. Okay? This is an illustration of a stomach crack. It has a white crack at the center of the tongue body. Okay? This is another example of a stomach crack. It has a crack in the center with horizontal cracks. Okay? This is a heart crack, a long midline crack. If the heart crack is shallow and the body color is normal, this simply indicates a constitutional tendency to heart patterns. But if the crack is deep, it indicates heart problems. Okay? This is how a heart crack looks like in a real tongue picture. Okay po? Again, a picture of a heart crack, but this time it is with red tip and has red points at the anterior third. This indicates heart heat or heart fire. Okay, if the heart crack is shallow and the body color is normal, this simply indicates a constitutional tendency to heart patterns and does not have a specific clinical significance. However, if a person has such a crack, any emotional stress from which he or she might suffer will have deeper repercussions than for someone without a heart crack. According to Dr. J.H.F. Shen, a shallow heart crack with a normal body color may also indicate heart disease in the parents or even grandparents. If the heart crack is deep, it indicates that the person may suffer from a heart pattern due to emotional stress, all the more so if the tip is also red. The following are different situations of emotional stress in order of increasing severity as manifested on the tongue. These are as follows: shallow heart crack, normal body color; no heart crack, deep red tip; deep heart crack, normal body color; shallow heart crack, red tip; deep heart crack with red tip; deep heart crack with red tip with red points, deep heart crack with red tongue with redder tip and red points. And the last is deep heart crack with red tongue with redder and swollen tip and red points. So this is ito po ang pinaka-severe. Okay, thank you po for listening.
Thank you very much, Ma'am Teresita. Please ask your questions now. Okay. From tongue diagnosis, we proceed to diagnosis by interrogation. And let's have Ma'am Vina Pascua straight from Baguio to give the presentation. Good afternoon po, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, continuation pa rin ito kahapon. Feeling of cold, day 15. Acute fever 3, part 3 po. So, itong damp heat in the stomach at saka intestines. Ang clinical manifestations ay nilalagnat si patient, gusto po niyang uminom, uhaw siya pero wala pong desire to drink. Loose stools, abdominal pain, nakakaramdam po ng heaviness, red tongue with sticky yellow coating, at saka slippery rapid pulse po. Ito yung damp heat in the stomach at saka intestines level within the 4 levels po. The next po tayo ay heat at nutritive chi level. Clinical manifestations, nagkakaroon po ng lagnat sa gabi, nauuhaw siya, tuyo din ang kanyang mouth with no desire to drink, mental restlessness, delirium, aphasia, or coma. Pag aphasia, ito po yung language disorder. Red tongue without coating, fine rapid po ang kanyang pulso. Ito yung heat sa nutritive chi level within the 4 levels po. The next naman po ay sa blood level na po yung heat. Clinical manifestations, fever at night, thirst, mental restlessness, may bleeding na, seizures at tremor. Ito yung panginginig, red tongue without coating, fine rapid pulse. Ito yung heat na nasa blood level po within the 4 levels. At idagdag po natin to the above interior patterns with internal fever of the 4 levels. Dalawang common patterns po from interior heat which may give rise to an acute internal fever are damp heat in the gallbladder and liver, as in acute cholecystitis. Swelling or inflammation of the gallbladder po yung cholecystitis. And then, damp heat po sa bladder, as in acute cystitis naman. Damp heat in the gallbladder and liver, clinical manifestations, fever, yung panlasa po ay mapait and sticky taste. Hypochondrial pain, which may extend to the right shoulder and scapula. Nagkakaroon po ng irritability, a feeling of oppression of the chest, nausea, vomiting, dark po ang kanyang urine, at ang kanyang dila ay pula po sa sides and sticky yellow tongue coating. Ang pulso po ay wiry, slippery, rapid. Then ang last po naman ay damp heat sa bladders, clinical manifestations, may fever, burning of urination, mahirap din siyang umihi, scanty dark urine, at meron na pong blood sa kanyang ihi. Mental restlessness, sticky yellow tongue coating sa root of the tongue. At ang pulso po ay slippery, rapid. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Thank you po. And if there are questions, please ask them now. Let's now proceed to pulse diagnosis. Okay. For today, we will talk about the right rear position, the small intestine and kidneys. So this is the structure of the right rear pulse position. Okay? So yung small intestine, okay, kidney, medyo sa likod ng kidney, malapit sa atin, proximal. Then the lower burner is distal. Floating. Okay, a floating quality on the right rear position reflects pathology of the small intestine. So meron pong heat in the small intestine. Weak pulse, a weak quality on the right rear position reflects pathology of the kidneys. If the pulse is deep and weak, kidney yang deficiency. Slippery quality, pathology of the small intestine, dampness. If slippery and wiry, there is damp heat in the small intestine with chi stagnation. This is seen in ulcerative colitis. If the pulse is slippery but deep and slightly weak, there is retention of dampness in the small intestine and kidneys. Wiry. A wiry quality on the right rear position, pathology of the small intestine. So there is chi stagnation. If the pulse is wiry, long, and rapid, damp heat and chi stagnation in the small intestine. This is seen frequently in ulcerative colitis. If the pulse is wiry but fine and rapid, damp heat in the small intestine occurring against the background of kidney deficiency. So let's summarize. Floating on the right rear position, heat in the small intestine. Weak, kidney deficiency. If it is weak and deep, kidney yang deficiency. Slippery, dampness in the small intestine, damp heat with chi stagnation in the small intestine, slippery and wiry. Ulcerative colitis, slippery, wiry on both rear positions. Dampness in the small intestine and kidneys, slippery, deep, weak. Wiry, right rear position. Stagnation of chi in the small intestine, damp heat with chi stagnation in the small intestine, wiry, long, rapid. While damp heat in the small intestine with kidney deficiency, wiry, fine, and rapid. Thank you very much for listening. Any questions? Okay, if there are none, we will now proceed to differential diagnosis. Let's call on Ma'am Neets for her presentation. Good afternoon po, Ma'am Neets.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Very clear po.
Thank you. So, in our TCM Foundations, number 180 is liver chi invading the stomach. Okay? Etiology, yung states of resentment, frustration, and anger over long periods of time. Kinikim-kim yan. So, underlying and accompanying pathology, liver chi stagnation. Okay? Sign and symptoms, hypochondrial or epigastric distension, sighing, hiccup, nausea and vomiting of sour fluid, poor appetite or aversion to food, para ayaw kumain, diarrhea, dizziness, belching, churning sensation in the stomach, irritability, breast distension, and tenderness in women. Okay? Ang pulse pag pinalpate ay wiry, especially on left middle position. Okay. Tongue, if you observe the tongue, it's normal in color and yung size medyo red. Okay. So treatment principle, calm the liver and harmonize middle burner, supplements stomach chi, regulate intestine. Okay. Acupuncture treatments, points we're going to use, bladder 21, regulates the center, harmonizes the stomach. Stomach 36 supplements stomach and spleen. Spleen 6 supplements the spleen and regulates the liver. REN 12 or CV12 harmonizes the stomach. Stomach 25 regulates the large intestine, and stomach 21 harmonizes the middle burner. So yung points na yan, ang technique na gagawin natin ay with supplementation or tonifying. Okay? So ito namang ibang points naman to. Bladder 18 regulates liver qi and blood. Liver 3 forces liver qi and subdues the yang. Gallbladder 34 forces the liver qi. Sanjiao 6 benefits lateral costal region. Pericardium 6 lowers rebellious qi. Liver 14 harmonizes liver qi in middle burner, and stomach 19 lowers rebellion. So these points, we're going to use the needle with drainage or even method. Okay? Thank you very much. I hope you learn. Thank you.
Yes, of course,
So,
we learned a lot. Thank you po, Ma'am Needs. Questions? Okay, if there are no questions, let's now proceed to acupuncture patterns and practice. And this will be presented by Ma'am Mildred. Good afternoon, Ma'am Mildred. She will continue her discussion of stomach ache.
Hello po. Magandang hapon po muli. So, acupuncture patterns, practice, stomach ache. Key points of analysis. Acute versus gradual onset. If stomach aches begin abruptly, it is mostly due to attack by exogenous events, dietary indiscretion inducing cold, or gross overindulgence in food and drinks. Any of these can lead to cold enduring yang in middle jaw or food retention with indigestion. So kung stomach ache naman po ay dahan-dahan siya, pwede po ito dahil due to liver blockades or qi impedance or insufficiency and dysfunction of the spleen and the stomach. Or either case, there is disharmony between the liver and the stomach, conducing to qi stagnation and blood stasis. So kung heat or cold nature naman po, the nature of cold is to congeal in strains. Kasi pag malamig talaga, kinukongeal po niya yung blood. So hence, pain induced by cold attacking the stomach tends to be accompanied by epigastric distension with guarding, anorexia, pallid tongue, coating, and a taut and tight pulse. Pain induced by cold arising in deficiency of spleen and stomach, yang tends to be vague and accompanied by preference for warm and pressure, worsening by cold limbs, a pale tongue with thin coating, and a feeble pulse, pain induced by guild heat or fire, causing the stomach to lose its descending transportation function, tend to be accompanied by irritation. Tapos nauuhaw po siya with the desire to drink. Heat aversion, mas gusto niya yung cold preference. Tapos konti po yung ihi niya, nagkakaroon ng constipation, may dry tongue, coating, and a taut and rapid pulse. Pag deficiency naman po versus strength, ang stomach ache po ay with distension and constipation is mainly due to an illness caused by strength pathogenic evils. So yung sakit po ng tiyan without distension or constipation ay dahil sa due to an illness of deficiency. So mas preference po niya yung lamig. Suggests an illness of strength. Preference for warm suggests one of the deficiency. Guarding the abdomen suggests an illness of strength. Amelioration by pressure suggests one of deficiency. Yung pag diniinan mo, mas nawawala po yung sakit. So, deficient yun. Pero pag aggravation following eating suggests an illness of strength. Parang excess condition kasi pag kumain, masasakit. Aggravation by hunger suggests one of deficiency. Yung pag nagutom, mas deficient po siya. A replete pulse and abdominal chi movements suggests an illness of strength. Depleted pulse and insufficient chi suggests one of deficiency. Severe and acute pain with fixed location suggests an illness of strength. So pag moderate and slow pain naman po, without fixed location, ito po ay deficiency. Kung bago pa lang ang illness in the patient with a stout body tends to be strength. A chronic illness in a patient with weak constitution tend to be deficiency. So yun po yung pagkakaiba niya, no? Chi versus blood. In general po, an illness in the initial stage tends to be one of chi abnormality. A chronic illness tends to be one of the blood abnormality. Kasi kung matagal na nga yung sakit, naapektuhan na yung blood. A chi type of pain is frequently accompanied by distension. Distension tends to be the main symptoms, whereas pain tends to be intermittent and without fixed location. Pag blood type naman, ang pain is usually persistent at parang merong stabbing inequality, tsaka fix yung condition. So kung titingnan po natin yung tongue, may cyanotic. So yun po yung may blood stagnation. Tapos pain due to retention of food naman or blockage by phlegm tend to have fixed location. So yung acupuncture treatment po natin ay gamitin po natin yung CV12. Pericardium 6, stomach 36 are among the most commonly selected acupoints for treating stomach ache. So kung mayroon pong stagnation, siyempre yung mga liver points po, liver 14, sanjaw 6, and gallbladder 34. Pag may food retention naman po, stomach 21, CV11, and stomach 25. Pag stomach fire, stomach 44 po. Yan, kasi alam naman natin yung stomach 44 ay water point at ang stomach 25. Pag stomach cold naman po ay bladder 20, yung baksyon ng spleen. Malalakasin din yung stomach. Bladder 21 and spleen 4. Pag may blood stasis naman po, siyempre bladder 17, yung mga special points for the blood, tsaka liver 14. For pain due to parasite, ito po, stomach 2. So, needle through Xinjiang. At large intestine 20. Stomach 25. Spleen 10. Stomach 37. Pag may gastric distress naman po and acid regurgitation, so add po ang gallbladder 34 and gallbladder 40. In general, for illness of strength or heat, apply the reducing method. Kasi pag strength or heat, excess condition. For illnesses of cold or deficiency, so apply the reinforcing method and moxibustion. Kailangan natin i-moxa kasi may cold. Yung case study po natin, case study 1, the patient was an adult male who had suffered from stomach ache for several years. So ang pain po niya ay was worse kung walang laman yung tiyan and lessen with food. She also had much eructation. His tongue coating was greasy in the middle. The tongue itself was somewhat pale. His pulse was small and taut. So ang diagnosis po dito ay stomach ache due to deficiency and stagnation of middle jaw. Yan. And failure of the stomach function of harmonizing and descending. So, ang therapeutic principle po dyan, siyempre, strengthen the middle jaw and warm the stomach. Case study number 2. The patient was a 71-year-old male who had stomach problem for 20 years. Nako, ang tagal na. The current problem began 2 weeks ago with periodic pain, worse in the afternoon and the night. So, ang sakit daw po ay burning and accompanied by epigastric mass, eructation, anorexia, and a dry mouth. Yung tongue po niya ay red with a coating that was yellow, greasy in the middle. Yung pulso niya, taut and thread-like. So, ang diagnosis po dito ay stomach ache caused by dampness, heat, blocking the middle jaw, and failure of stomach chi to harmonize and descend. So, ang therapeutic principle po doon, regulate chi and settle the stomach by means of bitter to induce descending in acrid to and black. So, thank you po.
Thank you very much, Ma'am Mildred. Any comments, questions? Anyone would like to share? Okay, now let's go to symptoms, signs and symptoms. We will call on Ma'am Teresita once again. She will now continue with, she will talk about dry and dull teeth, yellow and dry teeth. Good afternoon, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Signs and symptoms. Now let's talk about dry and dull teeth, yellow and dry teeth. Kidney yin deficiency. Signs and symptoms are dry, dull teeth that look like dry bones, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth and throat at night, lower back ache, ache in bones, nocturnal emissions, constipation, dark scanty urine, fertility, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, normal colored tongue without coating, and the pulse is floating. In kidney yin deficiency with empty head, signs and symptoms are very dry, dull teeth that look like dry bones, dizziness, tinnitus, vertigo, poor memory, hardness of hearing, night sweating, dry mouth at night, five palm heat, a feeling of heat in the evening, Meller flush, menopausal hot flushes, thirst with desire to sip fluids, lower back ache, ache in bones, nocturnal emissions with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, anxiety, insomnia, excessive menstrual bleeding, red tongue without coating, floating empty, and rapid pulse. In liver blood deficiency, signs and symptoms are dry, dull teeth, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull pale complexion, pale tongue, and choppy or fine pulse. Now let's go to yellow and dry teeth. In damp heats in the stomach and spleen with predominance of heat. Signs and symptoms are yellow and dry teeth, dull yellow complexion, a feeling of fullness of pain of the epigastrium and lower abdomen, poor appetite, a feeling of heaviness, thirst without a desire to drink, nausea, loose stools with offensive odor, a feeling of heat, dull yellow complexion, sticky taste, red tongue with sticky yellow coating, and slippery rapid pulse. In kidney yin deficiency, signs and symptoms are dull, yellow, and dry teeth, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth and throat at night, lower back ache, ache in bones, nocturnal emissions, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, normal color tongue without coating, and the pulse is floating empty. Now, in accumulation of cold in the abdomen with false yang above, signs and symptoms are yellow and dry teeth, abdominal pain, feeling cold, cold feet, pale tongue, tight, slow pulse. Now let's go to gray teeth. In kidney yin deficiency with empty heat, signs and symptoms are gray and dry teeth, dizziness, tinnitus, vertigo, poor memory, hardness of hearing, night sweating, dry mouth at night, 5 palm heat, a feeling of heat in the evening, Meller flush, menopausal hot flashes, thirst with a desire to sip fluids, lower back ache, ache in bones, nocturnal emissions with dreams, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, depression, anxiety, insomnia, excessive menstrual bleeding, red tongue without coating, floating empty, and rapid pulse. Now let's go to upper teeth moist and lower teeth dry. In kidney and heart yin deficiency with heart empty heat, kidneys and heart not harmonized. Signs and symptoms are upper teeth moist and lower teeth dry, dry mouth with a desire to sip water, palpitations, mental restlessness, insomnia, dream disturbed sleep, anxiety, poor memory, dizziness, tinnitus, hardness of hearing, lower back ache, nocturnal emissions with dreams, a feeling of heat in the evening, night sweating, 5 palm heat, scanty dark urine, dry stools, red tongue with redder tip and a heart crack, floating empty and rapid pulse, or a pulse that is deep and weak or on both rear positions and overflowing on both front positions. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, any questions? Wala pa rin. Okay. We will now
Nandun na
go
po yung
to
multiple color ng ano, Dok, ano, ng ngipin.
yes.
From white to
May mga
yellow.
meaning pala yun, no? Grabe.
Opo.
So interesting. So this actually, the presentations are very inspiring.
Opo.
And now,
Maganda.
yeah, we go to the finale. Finally. Okay, nasa atopic eczema pa rin tayo. Okay, this is still under, please forget about the title, hindi po anxiety, it's still asthma. Sorry about that. We're still on asthma. So we will continue with acute eczema, wind heat. The points to use are triple burner 6, gallbladder 31, so bladder 12, LI 11, LI 4, do 14, spleen 10, spleen 6, liver 2, heart 8, heart 7, the extra point, Yang Shui, lung 7, kidney 6. So combination po talaga ito, no? Lung 7 and kidney 6. Right lung 7 sa babae, left kidney 6. Now lung 9, kidney 3, and then the Sifeng extra point. So we use reducing method kasi gusto natin tanggalin yung heat on all points except spleen 6, lung 7, kidney 6, lung 9, and kidney 3. Kasi puro po ito yin, which should be tonified. No moxa. Triple burner 6 and gallbladder 31 are the main points to expel wind heat from the skin. Bladder 12 will help to expel the wind. LI 11 and LI 4 will expel wind heat and cool blood. 214 is used if the heat is pronounced. Okay, spleen 10 and spleen 6 will cool and nourish the blood. This is necessary according to the principle of harmonizing blood in order to expel wind. Liver 2, if there are signs of liver heat, it also expels wind. Heart 8 and heart 7 will stop itching. One of these points is used if this symptom is pronounced. Then the extra point, Yang Shui, will stop itching. Where is it located? Tutsun, directly above LI11. Okay. Lung 7 and kidney 6, combination po yan. This will open the renmai. Okay, so tonify the lung and kidneys defensive chi systems, nourish the essence, and benefit the skin. These points are used in women. Okay. Lung 9 and kidney 3, kasi wala namang matris ng lalaki. Yun ang ano sa penetrating and sa renmai. Lung 9 and kidney 3 tonify the lung and kidneys defensive chi systems and benefit the skin. These points are used in men. Okay, Sifong or extra points can be pricked in infants for acute wind heat. They are located in the cracks of the fingers. Now, let's go to damp heat. If you remember, involved dito yung kidney, no? Acute eczema. LI11, spleen 9, spleen 6, DO14, spleen 10, REN12, bladder 20, lung 7, and kidney 6. So, it's really a pair. Kailangan partner po siya. Lung 9, kidney 3, and Sifong extra point. Reducing method po, except on REN12, bladder 20, lung 7, kidney 6, lung 9, and kidney 3, which should be reinforced or tonified. No moxa. Okay, so explanation. LI11 and spleen 9 will resolve damp heat. DO14 and spleen 10 will clear heat and cool blood. We use REN12 and bladder 20 to tonify the spleen to resolve dampness. Lung 7 and kidney 6 in combination are used in women to open the REN, or the directing vessel, tonify the lung and kidneys defensive chi systems, nourish the essence, and benefit the skin. Tapos sa lalaki naman, lung 9 and kidney 3, to tonify the lung and kidneys defensive chi systems and benefit the skin. Sifong in infants will expel damp heat. Now let's go to chronic eczema, wind heat with blood deficiency. Triple burner 6, GB31. Of course, nandiyan pa rin yung bladder 12, LI11, LI4, 214, spleen 10, spleen 6, liver 2, heart 8, Yang Shui, extra point, lung 7, kidney 6, lung 7 and kidney 6, lung 9 and kidney 3, and then we have stomach 36, bladder 17, liver 8, REN 4. Even method po on all points, except spleen 6, lung 7, kidney 6, lung 9, kidney 3, stomach 36, bladder 17, liver 8, and REN 4, which should be reinforced. No moxa. Triple burner 6 and GB31, if you remember, ito po yung main points to expel wind heat from the skin. And nandiyan na pa rin yung bladder 12 to help expel the wind, LI11 and LI4, very good for expelling wind heat and cooling the blood. DO14 is used if heat is pronounced. Spleen 10 and spleen 6 will cool and nourish the blood. This is necessary according to the principle of harmonizing blood in order to expel the wind. Liver 2, if there are signs of liver heat, helps to expel wind. Again, heart 8 can stop itching, and we use heart 8 if grabe po yung itching. The extra point, Shi Yang Shui, will stop the itching. Nasaan po ito? Tutsun, directly above LI11. So try that. Heart 8, the extra point, Shi Yang Shui. Lung 7 and kidney 6 in combination for women to open the REN channel, or directing vessel, tonify the lung and kidneys defensive Qi systems, nourish the essence, and benefit the skin. So yung gusto mong pagandahin yung pasyente mo, no? Lung 9 and kidney 3 are used in men to tonify the lung and kidneys defensive Qi systems and benefit the skin. So lung 7 and kidney 6 for women, lung 9 and kidney 3 for men. Stomach 36 and bladder 17 will nourish the blood. Liver 8 and REN 4 are reinforced if there are symptoms of liver blood deficiency. Now we go to chronic eczema points, damp heat. LI11, spleen 9, spleen 6, DO14, spleen 10. Again, the extra point, Shi Yang Shui, REN 12, bladder 20, lung 7 and kidney 6 ulit for women, lung 9 and kidney 3 for men. Reducing method, except on REN 12, bladder 20, lung 7, kidney 6, lung 9, and kidney 3, which should be reinforced. No moxa. LI11, spleen 9 and spleen 6 to resolve damp heat. DO14 and spleen 10 to clear heat and cool blood. Then the extra point, Shi Yang Shui, located tutsun above LI11 to stop itching. Then REN 12 and bladder 20 to tonify the spleen para ma-resolve yung dampness. Diyan naman yung lung 7 and kidney 6. In combination po yan, lung 7 po sa right, kidney 6 sa left. Okay, ginagamit yan for women to open the renmai or directing vessel, to tonify the lung and kidneys defensive Qi systems, nourish the essence, and benefit the skin. Yung mga nangingitim na po yung balat, no? Especially doon sa REN area. Then for men, lung 9 and kidney 3, lung 9 sa left, kidney 3 sa right. To tonify the lung and kidneys defensive Qi systems and benefit the skin. Wow. Share.
Hello, Doc. Ay,
Opo.
share lang po ako dyan sa ng eczema due to damp heat. May nag-share po kasi na isang practitioner. Ngayon po napakarami di bang nakikita sa YouTube ng mga product. So, ginaya lang po niya, nag-order, ginamit sa katawan, pero dahil hindi nga niya alam yung pattern at siyempre kung hindi naman nanonood sa YouTube natin or nag-open para malaman, ginamit po yung product. Tapos mas nag-rashes siya kasi heat pala yung binibigay ng product. Mas lalong dumami yung damp heat. Kaya siguro ang lang natin, paalala natin sa mga nakikinig sa atin, kung may product na nakikita sa YouTube,
Huwag
mas maganda.
basta-basta.
Opo, kasi baka lalong lumala yung sitwasyon dahil ang kate may mga pattern tayo kung iyan ay lamig or init. So kung ang nabili mong product nag-release ng heat, then nilagyan mo pa yung katawan ng heat, lalalo po hindi kayo gagaling.
Totoo. Totoo po yan. Yeah. So, marami pang mag-share. Okay. Thank you very much po, Ma'am Mildred, for sharing. Thank you everyone, especially po sa mga presenters for sharing their precious time with us. And tuloy-tuloy po tayo. See you po next week. Good evening, everyone. Thank you
Ay,
po.
Doc,